Here I present one of my challenging cases of iStent insertion after cataract surgery. After successful cataract surgery and confirmation of the angle anatomy, the anterior chamber is filled with viscoelastic, and then the iStent is inserted into the anterior chamber. Viscoelastic is also placed on the surface of the cornea, and then the gonio lens is put into place for adequate view. Note here that initially the view of the angle is fairly clear as I approach with the iStent insert, aiming at a 15-degree angle and attempting to insert into a clear trabecular meshwork that's pigmented. My approach appears to be good of inserting and then straightening so that I can push the iStent tip forward into Schlemm's canal. My view has begun to be a little bit less clear with corneal striae, and I make an error here by pulling too forward and break tissue and pull the iStent out of the correct position. Now my second attempt is the view is not as clear, my anterior chamber has begun to shallow, and because of the hypotony there is significant bleeding from my first attempt. I quickly try to make a second attempt in an area that appears to be clear. It looks like I have been able to insert, and I go back with viscoelastic to clear the heme to make sure that the insert is proper, but I see that it is not completely inserted well. So I make a third attempt after re-grabbing. Again, my cornea view is initially clear right after viscoelastic, but with the egress of the viscoelastic through the corneal wound, it quickly becomes more shallow and the corneal folds ensue. Now the heme from inside has gotten out and onto the surface of the cornea, so I wash that away with VSS. Here now, attempting for the third time, after having refilled the chamber with viscoelastic, my view is quite difficult with a lot of heme and again ensuing cloudy cornea with striae. I make a third attempt here, feeling that I might have got it in good position. Again, very difficult view. Here it looks as if I might have it in good position. I'm tapping it into place, feeling like it's not properly seated into the correct position of Schlemm's canal. At this point, I must see that it's not in the adequate position. After many attempts to tap it in, and I decide to just re-grab and attempt again. Here I remember contemplating, because it's been almost 15 minutes, should I continue or should I stop? Looking one more time at where I can place it, I try my last attempt. I place the gonio lens on and look one last time. I seem to find a place that appears adequate for placement of the iStent. I insert, move forward, and then I'm able to release. And it looks like the iStent is in good position. I tap briefly, see that it is secure, and then I get out. Now I'm irrigating the remaining viscoelastic and heme from the eye. I look once again and just confirm that it is in good position. Now I'd like to show you the beauty of the slight modification of iStent first. Prior to cataract surgery, I confirmed the angle anatomy, then make a small incision with a 15-degree blade, 1.4 millimeters. I depressurize the eye, then insert my anesthetic which is sugarcane. This is followed by a dispersive viscoelastic, which helps to deepen the chamber, providing an adequate pressure so that there is a clear view. It's important not to overfill the eye. Then I insert the iStent through the corneal incision. Then I place viscoelastic on the surface, followed by the gonio lens. Here, with a now clear view of the angle, I take my iStent across to the trabecular meshwork and prepare for insertion. With a 15-degree angle, I insert the tip, piercing through the trabecular meshwork and then into Schlemm's canal. With a forward motion, the iStent is inserted. Here, my initial entry wasn't what I wanted, so I re-grabbed and reinserted it so that it was in good position and stable. Realizing that even with more motion, I wasn't going to get this in the right position, I re-grabbed and found a completely new point in order to reinsert the iStent. Note the beauty of this technique with the viscoelastic. There's minimal bleeding even after cutting through trabecular meshwork tissue because there's adequate pressure in the eye. This allows you to have a clear view to reinsert as needed. Here I've reinserted the iStent into a new position, slightly tapping the snorkel in order to get it into right position. Now there's an egress of heme, which helps me to know that I am in good position, but that amount of heme is not excessive so that I can still see what I'm doing to properly insert the iStent. There's no need for me to have to come out of the eye to re-inflate the anterior chamber with more viscoelastic for pressure or for a view. Now after insertion, cataract surgery can be performed. Here is a view post-cataract removal with the iStent in good position.